Good evening and welcome to the Department of Human Services public hearing on block grant. Thank you to the members of our Human Services team for holding these hearings. The hearings allow our residents to learn more about Human Services block grants and contribute their valuable input on how we can best support our communities and some of our most vulnerable residents. I'd like to take this time to thank a few key members of the Human Services team: Sandy Garrison, Angelique, Gaston Gonzalez, Janet Drightline, Donna Holliday, Alicia Redden-Ravel, Pam Bell, Jessica Fink, Jackie Hartney, Vandy Morse, and Warner Williams. It is through your hard work and dedication that these grants are available to help some of our most vulnerable residents in Delaware County. So thank you for the work that you're doing and the work of all of Human Services. Some of you may not know what Human Services block grants are, so I will briefly give you some background. The Human Services Block Grant was initiated in 2012 through Act 80 and allowed 20 counties, including Delaware County, to enter the pilot program. Funding for some human services programs, such as mental health, intellectual and developmental disabilities, drug and alcohol, adult services, and children and youth services were combined, which permitted counties to allot the funds based on the service needs. The Human Services Block Grant allows the county to fund services to individuals who are homeless, have intellectual and developmental disabilities, mental health or drug and alcohol disorders. Block grant dollars are also utilized for individuals who may not have funding from any other source, such as medical assistance. Delaware County's human services model placed us in an optimal position for this funding approach. The Human Services Block Grant has been very beneficial for us, as you will hear during today's presentation. This public meeting also allows us to receive feedback from stakeholders regarding service needs and services provided by the county. Counties, in their leadership role, are required to identify local needs, develop goals, create strategies, and identify and track outcomes that support the implementation of quality, cost-effective, and efficient services. Counties are responsible to complete the planning process and submit the required plan, which describes how services are delivered in the areas of mental health, intellectual disabilities, homelessness assistance, substance use disorder, and other human services. The plan should also describe coordination and cooperation with other critical services not directly administered by our county government. Additionally, we will be discussing the strides we've made during fiscal year 2021-2022 and our goals for the upcoming year. I'd now like to introduce the Director of Human Services and Community Support, Ms. Sandy Garrison. Sandy.
Thank you, Dr. Taylor. And to reiterate what Dr. Taylor said, I welcome everybody to the Human Services Block Grant public hearing. We have done a lot of fabulous things over the past year and have a lot of intense plans for the upcoming year. I also want to thank the Human Services team for their work on this plan and their work every day in this field, working with the most vulnerable residents of our county. With that, I would like to turn it over to our Interim Human Services Director, Angelique, to talk about our goals and mission.
Hello, I'm Angelique. I'm the Interim Director for Human Services, and the Human Services mission statement reads, Delaware County Human Services is committed to addressing the social service needs of county residents in an inclusive and equitable manner with a holistic, trauma-informed, culturally competent, fiscally responsible approach designed to meet the statutory mandates of the respective program offices. One of the things we're really proud of is that we have a Human Service Racial Equity Statement, which is the Delaware County Department of Human Services acknowledges and understands historical and ongoing systematic racism exists in our work environment. Racialized practices and behaviors which result in disparities and inequities within our department will not be allowed to continue and must change. The department's goal is to create an organizational culture of inclusion and equitable success where the unique voices of all are valued, thereby bringing demonstrated diversity and creativity to our workplace and services provided. So I'm going to pass it on to Janet.
Good evening, everyone. I'm Janet Drightline. I'm the Mental Health and IDD Administrator for Delaware County Department of Human Services. The mental health mission and vision statements. Delaware County Department of Human Services Mental Health Office's mission is to assure the provision of comprehensive array of quality mental health services and supports for eligible adults and children that will assist participants in maximizing autonomy, independence, and self-determination. We do this by collaborating with as many adults, families, systems, and providers as possible to identify individuals who are in need of mental health services. We strive to educate all of our stakeholders and our systems partners regarding the need for and delivery of culturally competent, trauma-informed, and evidence-based services. Jessica?
Good evening. My name is Jessica Fink. I'm the Adult and Family Services Administrator. Adult and Family Services oversees a wide range of community services to families and adults in Delaware County and is responsible for the oversight and contracted services that fall under the continuum of care for homeless programs, including homeless prevention, emergency shelter, permanent housing. Adult and Family Services also provides contractual oversight for food assistance programs, medical assistance transportation, and a variety of other supportive services. Adult and Family Service supports agencies through ongoing education and the provision of tools to ensure equity in their services to assist families and adults in leading safe, healthy, and productive lives and break the cycle of homelessness. Families and adults will receive equitable, trauma-informed, and outcome-focused services from provider agencies. Lauren?
I am the Drug and Alcohol Supervisor for the Department of Human Services. It's an independence and community inclusion of individuals, children, and adults with intellectual and developmental disabilities and/or autism spectrum disorder in Delaware County. We envision a community that includes people with intellectual and developmental disabilities and/or autism spectrum disorders as a full member of society who self-advocate to the greatest extent possible, fulfilling lives and utilize natural and supports as necessary as a part of the meaningful life. Thank you.
So a little bit of background was about the Human Services Block Grant. I know Dr. Taylor spoke to some of this. It was initiated in 2012, 2013, and with it, all counties received a 10% cut in their budgets. However, Delaware County was one of the original 20 counties selected to participate in the block grant, and we really were in the optimal position at that point because of the way we were already structured. We did have the Human Services model, and what that means is that all of the various categoricals and some other offices were all under one umbrella, and we had a joint fiscal contracts, and information technology, information systems, and so forth, office that served all the different categorical programmatic offices. We also initially, I mean, you can see the services are up there, and you'll hear more about the mental health, drug and alcohol, intellectual and developmental disability, and our adult and family services programs. Initially, children and youth was also included, but they're no longer included in the block grant. And it's really been beneficial, and I'll speak to that shortly, of the things we've accomplished over the years in the block grant and the things, especially this year, that we've been able to do. So with that, I will turn it over to Angie to go through our team.
Got to push. Sandra Garrison is our Chief for Human Services and Community Services. Angelique, which is myself, I'm the Interim Human Service Director. Gaston Gonzalez is our Chief Financial Officer for Human Services. Janet Drightline is our MHIDD Administrator. There's Donna Holliday, our Mental Health Deputy Administrator. Alicia Redden-Ravel, OIDD Deputy Administrator. Pam Bell, Drug and Alcohol Administrator. Jessica Fink, Adult and Family Service Administrator. Jackie Hartney, our Fiscal Officer for Human Services. Vandy Morris-Array, another Fiscal Officer for Human Services. Warner Williams, an Accountant for Human Services, and MHIDD and the DAA Advisory Board.
So for our stakeholders, We have the list of everybody that's involved in this, and this is all of our community partners, our providers that are very key to the county, our advisory boards, different coalitions throughout the county. You can see it's a large range of individuals and groups that participate in the development of this plan. And as we talked about, one of the main pieces is to get community input, which is why we do have the plan publicized. We do have these hearings because we really want to make sure the services that we're looking at doing really fit the needs of the residents, and definitely want to get our county resident input. So just to look back a little bit on what we've done with the block grant over the years. The block grant has allowed us the flexibility. The beauty of the block grant is we get our funding for the various categoricals. And in the past years, we'd have to return those funds if we didn't use them. So say 1 year mental health did not use all their funds. Instead of using them for other need in the county, they'd have to go back to the state and otherwise be distributed for other purposes. So with the block grant, what we were allowed to do is all the services in the block grant, we're allowed to move the funds between those various categorical services and best suit the needs of our county. So it's really allowed a lot of flexibility. Two key examples are when the block grant was first initiated, our drug and alcohol system was historically underfunded. We would either shut down the system at different times during the month, or at the end of the year, there'd be several months where we could not provide services because we just didn't have the money to do it. The block grant has allowed us to shift monies and keep the drug and alcohol system open. We have not had to shut the system since the block grant was initiated back in 2012, 2013. Then the Obamacare came through. We had the medical assistance. It was expanded for individuals with behavioral health needs. So that allowed the individuals that we were, as a county, were otherwise being funded to be funded through the MA system, or our Health Choices program. With that, we also had an increase in individuals being served by our Intellectual and Developmental Disabilities Office. So this allowed us to shift monies to that office and make sure those individuals were supported. So a lot of our services, because people interact with multiple systems, and also because going into it, we might not in 1 year have the funds we need in one area, but we have extra in another area. We're able to combine them and use them for the best interest of our county. We also are allowed to maintain, currently the legislation is 5% of our unused funds. So each year there's a certain portion of the funds that maybe we don't need that year, but we know there's certain things we have to do the following year, or we'd like to do the following year. We're allowed to keep those monies within the county and use it for those purposes. We just have to write a plan to the state and explain what we're going to do. So with those retained earnings, we've been able to enhance our homeless services and provide additional funding for that, rental assistance program. And in this past year, we're able to use those funds to assist providers in maintaining and recruiting staff by allowing them additional funds to do that. So with that, I'd like to talk just a little bit about our accomplishments we made during fiscal year 21-22. We are continuing to coordinate within human services among all the various categoricals. We also are working with the county criminal and juvenile justice systems to make sure those individuals are being served appropriately and effectively. We have, as I'm sure everyone's aware, there's been a huge issue with Prospect Medical Holdings. And I've said this numerous times, council meetings, we continuously are amazed by the support of the community, the providers, not only within county government and not only within human services, but we've had numerous providers step up and pick up some of those gaps. The community has really pulled together and made sure this wasn't the crisis that it could have turned into. We also, like Ms. Heyer said earlier, the Unpacking Systemic Racism Project, we were very proud of our racial equity statement, and we're continuing that work to make sure we are doing things in an equitable and inclusive manner. We have the new Behavioral Health Managed Care Organization as of July 1. We transitioned successfully to Community Care Behavioral Health, which was a huge move for the county. And we also are hiring and training staff to ensure we have continuous services with interdepartment. We are looking at more of a remote work policy. We had the emergency rental assistance program, which was handed through human services, and that was in conjunction with other offices in the county, including the solicitor's office, the treasurer's, and the controller's office. And we all pulled together to make sure these funds were quickly and effectively handed to residents of the county that did need that rental assistance. So, avoid losing their home in the light of COVID. We also continue to coordinate with other offices within the county. That's one of the key pieces of the transitions we have with staff, that now we work not only with Human Services, but we're also pulling in COSA, we're pulling in, which is our, our aging office, we're pulling Veterans Affairs, Library Services, and our Housing and Community Development to make sure individuals are receiving the best comprehensive services that we can provide. The Healthy Kids, Healthy School initiative was initiated this year, and that was in conjunction with the District Attorney's Office and the county school districts to make sure children that when they come to school are receiving the services they need and are being addressed and being connected to any supports they need outside of the classroom as well as within the classroom. We also formed the Statistics, Data, and Quality Unit within Human Services, and this work had been going on individually within the various programmatic offices, but we now have somebody that can do it across the board with her staff for all the Human Services offices to make sure that our providers are providing high-quality services, and also to make sure that we as a department are doing the same. And this also is going to allow us to make more data-driven decisions. And we also are continuing to our no wrong door and one health, one welfare approach to services, which basically means whatever point someone touches our system, they get the services they need. So maybe they come through, early learning resource center, but the family needs mental health services. We make sure that person's connected instead of saying, oh, okay, you need to leave and you need to go over here. We do like a warm handoff and make that connection. So with that, I will turn it over to Lauren to talk a little bit about the accomplishments in drug and alcohol this year.
Again, good evening. I'm Lauren Armstrong. Some accomplishments that drug and alcohol accomplished this year, that we were able to serve 2,882 Delaware County residents. They were able to access treatment during the calendar year of 2021. Treatment services include recovery houses, inpatient, outpatient, CRS, which is a Certified Recovery Specialist program. Some other things that we did, we were awarded for our treatment needs assessment plan, and we are currently working on year 2 of our plan. We also have been awarded funding for several special projects, our LEDI program, which is the Law Enforcement Division treatment program, and we just awarded MVP as the provider for that program. We have site-based medication assessment treatment expansion, recovery support services at George W. Hill Correctional Facility. We also have a housing program, Finally Home, which focuses on case management for those who have opiate use disorder and stimulus use disorder.
So some of the accomplishments in the past year for mental health, we were able to expand our provider network, and as Sandy had mentioned, with the changes with Prospect Crozier, we were able to bring on some different providers and develop some new services and expand some other services. We also successfully were able to reintegrate many people that were living at Norristown or on the grounds of Norristown State Hospital into the community so that they could receive services in a more normalized and supportive environment. We successfully provided peer support training and had a graduation connected to that. The peer support program is a program where individuals with lived experiences are work within providers to support individuals in ways that people without the same experience might not be able to. So whether or not they are there to listen, it's not technically a clinical service, but it is a service that's really supportive to individuals because they can speak with someone who has had a similar experience to them. We were awarded the third 4-year system of care grant. This was a huge accomplishment specifically for Delaware County Mental Health. We are one of 4 counties in the state of Pennsylvania that was awarded this grant this time around. We have also received 2 community mental health services block grants. Those block grants are to expand some residential supports and also to expand our mobile crisis unit. We've continued our trauma-informed care training, some of which have been virtual, and those have been extremely important and very supportive of the providers in the community to make sure that we are promoting trauma-based care for individuals or trauma-informed care. We've continued the youth mental health first aid trainings, also something that we've developed here. We've had a crisis intervention training and graduation. Those trainings are specifically for first responders, at least these particular ones were, to have a better understanding of what happens in a crisis and how people respond to a crisis. We've sponsored adult and children's mental health awareness initiatives and activities. We were selected by the Stone Lee Foundation and Georgetown University to participate in a multi-system youth pilot project that will allow us to better and more consistently serve children or youth that are involved in the juvenile justice system, in mental health, and have issues at school, and also are connected with children and youth services. Our staff have been regularly connecting to providers to provide support for them in the community, given that we've had many programs that are struggling to bring back individuals with people who are uncomfortable being in buildings. So our staff have successfully and effectively managed their priorities working in a hybrid work schedule. And this has been a really important objective and goal for the staff. And it shows that, we have some very dedicated staff that don't necessarily need to be in the office in order to complete their work. Our trainings have been provided on a virtual platform as well as in person, dependent on the need of the consumers. And as I said before, our provider network has expanded, and we will continue to do that throughout the coming year. Alicia?
Some of the accomplishments of the Intellectual and Developmental Disabilities Office: we've decreased the use of base funding for long-term residential placement and increased the use of waiver fundings for community services by addressing the PUNS list. We've worked closely with the Office of Developmental Programs to obtain approval for the utilization of temporary staff to ensure the supports coordination organization services were consistently provided during a time of staff shortages. We've helped to distribute masks and information to families and individuals, including information on accessing vaccinations, working with the Office of Developmental Programs and Delaware County Emergency Management Services to access community vaccine clinics and vaccines for homebound individuals and families. We work with providers to ensure that all safety protocols were followed to decrease the risk of individual infections with the COVID-19 virus. We monitored weekly the COVID cases per provider agencies and delivered supports as needed. We also helped to ensure that all providers had access to vaccines and protection for their staff and individuals. We served 110 individuals in the family support services with the allocation of the community living waiver to address and enhance supports needed for 21 individuals. The successful allocation of funds to families from the American Rescue Plan Act to support respite and family-driven services needed. Successful allocation of funds to all of the Office of Developmental Programs providers to address staff recruitment, retention, and COVID-related staff expenses. We continue to meet with providers to ensure proper safety protocols were in effect and followed, connecting with individuals and families weekly to ensure safety and to assess their ongoing needs, provide in-person and virtual services to individuals and families to address any immediate or ongoing concerns, support providers as they reopen to have in-person services, work collaboratively with our county, providers, families to ensure individuals, families, and staff had access to anything that they needed, to work with providers to enhance and add new services to address emergencies and new needs within the program. And again, working with the Office of Developmental Programs to develop a pilot program for the temporary use of temporary staff. Thank you.
Sorry. The accomplishments for Adult and Family Services. We coordinated with the Office of Housing and Community Development and secured funding for COVID-19 related funding that allowed us to service 204 households temporarily in motels on Code Blue nights, November 1st through April 1st, when the temperature was 32 degrees or cooler. The outreach team identified 135 persons for services since their start November 2020. 61 persons have been engaged this fiscal year. The outreach team provides active outreach services throughout the county and can be reached by an 800 number. 93 households moved into rapid rehousing or permanent supportive housing during the fiscal year 21-22. And additionally, we were able to access 46 emergency housing vouchers through the Delaware County Housing Authority. 10 of those vouchers were in coordination with Domestic Abuse Project, were provided to survivors of domestic violence. As you might imagine, shelter space needed to be reduced during COVID, but we were still able to serve more than 550 individuals during the fiscal year July 1, 21 through June 30, 22. Shelters did remain open during the COVID-19 pandemic, as I mentioned, but at a reduced capacity. Despite the pandemic, the outreach team and volunteers were able to conduct the point-in-time count required by by Housing and Urban Development. There were 46 persons identified on that outreach. They were interviewed and offered shelter. And we are required by HUD, by Housing and Urban Development, to do that outreach to determine the need in our community. HUD provides $5 million worth of funding for us to serve the homeless population. The outreach team continued to engage street homeless persons and transport to shelters when requested. The county organized food drives through December 21, largely to assist independent pantries. And the Share Food program completed their first year as the food provider for Delaware County and has increased food access to areas previously underserved.
And so that is what we did, and I really like when we do this hearing every year because it really puts everything in perspective. I think we do so much throughout the year and we just keep moving forward and don't always take a minute to reflect. So I think for me, this was great to just reflect on everything we've done. And we really have accomplished a lot, especially given the coming out of a pandemic, given the fact that like everywhere else, we have staffing issues. And I'm sure many of you are thinking, well, what else could they do? But I am now going to turn it over to Angie to talk about what we're going to do for the year that's coming up.
And I would say we're excited because we're going to continue to collaborate with the county social service departments, and we've been doing that ongoing. We were meeting during the pandemic daily. It went to weekly, and we continue to meet several times a month because thinking out of the box, what can we do to serve all of the clients and all of the citizens of Delaware County is really our mission, because human services is not just what we do, is what we are. We care about people, and we want to make sure we're doing the best in terms of the service that we're delivering. So in that, by collaborating together, we've come up with programs that we never thought were possible, not just between providers, but between ideas of how we can share our resources. So in that, we're also implementing our racial equity plan. We're going to enhance awareness of services within the community. We're going to expand our partnership with county criminal justice and juvenile justice systems. Increase staff retention, which we know is something we're actively working on in terms of what does it look like to work for the County of Delaware, but actually what it is to be a human service employee. So also on that, we're going to evaluate providers and programmatic policies as a comprehensive basis with the statistics, data, and quality unit, which is new to us, but we're really looking forward to all the things that she's going to continue to do to ensure decision-making is data-driven. And ultimately, we're utilizing the existing no wrong door and one health, one welfare philosophy to maintain cohesive and comprehensive approach in terms of our service delivery. I would say Lauren was excited to share what we're going to do for drug and alcohol. So she read the slide in terms of sharing what our plan was. So you guys have heard about it, but she might want to hit some high points. So I'm going to pass it to Lauren.
Yes, so our prevention team will continue to meet our audience where they are by being creative and adapting both virtually and in person. This year has shifted the countywide Drug and Alcohol Prevention Coalition to increase capacity planning, implementation, and sustainability. Drug and Alcohol team will continue to work on our year 2 goal for the 2022 and 23 treatment needs assessment plan. which is outline priorities to address identified needs, gaps, and barriers. The priorities to continue to include a lack of transportation to treatment and recovery supports, language barriers, lack of interpreter services, warm handoff issues, and lack of available social recreational alternatives, workforce issues. Also, we have expanded our anchor providers. We have added 2 programs to our listing, MVP and American Treatment Network. MVP is an experienced provider who has a lengthy history in Delaware County. And American Treatment Network is new to Delaware County. And their program is equipped to provide a comprehensive continuum of care for our community.
So for the upcoming fiscal year for mental health, we will continue with an abundance of caution to reopen mental health treatment and recovery services in Delaware County. There are a number of services that are able to be provided through telehealth, and we will continue to support that and continue to support providers. We'll continue, as I said, continue this, and again, to the degree that that's clinically appropriate. We will continue to provide trauma and culturally informed post-pandemic resources to Delaware County stakeholders. Quality planning, quality assurance, quality control, and quality improvement to achieve new program development changes to improve the continuum of mental health services in the county. As you've heard from a couple of different people, we do have new providers that are coming into the county. We have existing providers that are expanding their current programs, as well as bringing up new programs. So during the coming fiscal year, we'll be working very closely with those providers to ensure that those services are being provided in a manner that is in the best interest of the individuals that we serve. And we will be implementing a new program, Mobile Crisis and Law Enforcement. We did get a grant through the congressional directive funding for that project. And we should be starting to bring that program up in the next month or so.
The intellectual and developmental disabilities. This year, we will continue to support our families and individuals with their everyday life, utilizing the life course tools. And this will be inclusion of through intake and the ongoing team process. In conjunction with the Office of Developmental Programs, local counties and service providers will restore and modify programs to service those displaced by the change in traditional day and community participation supports. Again, during the pandemic, we've had a lot of our programs just really hit really hard. So we want to make sure that we are supporting our families and being able to get new services. Provide a minimum of 4 direct trainings and resources to families to reduce risk, improve health, promote vaccines, understand service options, and improve understanding of the paperwork processes. Conduct a satisfaction survey to identify systemic issues and create a plan to address those issues. Increase opportunities for medically complex children to be supported in the community instead of congregate settings. Support the transition process for incarcerated individuals with intellectual and developmental disabilities to live successfully in the community. And lastly, develop additional data collection processes to allow for the effective and efficient provision of services.
Adult and Family Services will continue to reduce the number of households who become homeless as compared to the previous year. We will reduce the length of time households remain homeless as compared to the previous year, which will be a bit of a challenge this year because, as you know, rents have gone up and opportunities for our homeless to relocate are becoming harder to find. Transition households from emergency shelter or rapid rehousing into permanent housing whenever and as quickly as possible.
My name is Gaston Gonzalez. I am the Human Services Chief Financial Officer. And I will talk about the Human Services Block Grant Fiscal Impact that for the fiscal year 22-23, it is $46.4 million. The trend is just flat. From the prior year is just less than 1 percentage point. Exactly, it's a 0.57% increase. These total funds were allocated in the different services like mental health, $35 $4.2 million. That is 75.8% of the total allocation. Intellectual and developmental disabilities, $7 million. That is accounts for 16.9% of the total allocation. Drug and alcohol, $1.9 million, which accounts for 4.2% of the total allocation. Homeless assistance, that is $930,000, accounting for 2% of the total allocation. And finally, Human Services Development Fund, that accounts for $510,000, for 1.1% of the total allocation of the funds. And I will pass it to Sandy.
Thank you, Gaston. Our commitment to the county is Human Services. We are committed to addressing the social service needs of our county residents in an inclusive and equitable manner with a holistic, trauma-informed, culturally competent, and fiscally responsible approach designed to meet the needs of our residents and their statutory mandates, of our respective program offices. Before I open it up to questions, I just again want to thank everyone for coming tonight for the meeting. I especially want to thank every person that's not only here from the Human Services team, but all the ones that are at the office. On a daily basis, it's amazing of the work that gets done. And again, with limited staff, limited resources, and no matter what the challenge is, whether it's COVID, whether it's the situation currently with Prospect, regardless of what it is, I'm just on a daily basis amazed at how much everyone steps up to make sure that people aren't left without services. And I just really appreciate everything that's done by our department and Human Services. I also really appreciate the support we have of our county council. We couldn't do any of this without them, who were on the front lines with us, who were, when we're talking about Prospect, when we're talking about COVID, have meetings constantly, who were right there, hands-on approach to what can we do, what do you need from us? And I know I speak for the entire department when I just really say thank you. We really appreciate all the support we've received this year and prior years, and I anticipate going forward. So with that, I will open it up to questions or comments. If anybody who is watching this has a question or comment, it can be emailed to hs_blockgrant@delcohsa.org. We do ask that you provide your name and your address when providing a comment. So I'm also going to open up if anybody in the audience would like to come up and make a comment. Microphone, please. We did receive one email so far online. I'll read it and then we can discuss this. Good afternoon. My name is Tawilla Francis. I apologize if I did not pronounce your first name correctly. I live at 408 Harrison Avenue in Glen Olden. I understand the block grant plan for 2023 is under construction. How much funding will be designated for Crozier Mental Health outpatient services at Community Hospital? Will the dollar amount awarded Change of Christiana Care purchases the above mentioned program? Will staff be given any funds towards recruitment and retention? What I can say is we still are in the process of looking. Because the situation with Prospect Medical is so fluid, we're still in the process of looking at that contract. I know for those of you who watched our county council meeting last evening, the two contracts for mental health and for substance abuse services at Prospect were continued for the first quarter of the year, so that's through September 30 of this year, to give the county a chance to evaluate what services are still needed, where the gaps are. We were able to, again, as we've all stated, find alternatives to those programmings. I don't have a specific dollar amount as I sit here. Additionally, a lot of the services are funded on a fee-for-service basis, which basically means they're funded on an amount per hour or unit or day, depending on the type of service. And as we're invoiced, we would pay those through Human Services funds if the individual doesn't otherwise have insurance or medical assistance. As far as Christiana, if that comes to fruition, we would have conversations with them. And the county, I can speak for Human Services, and I probably speak for the county when I say we are committed to making sure our residents do have the services they need. As far as staff retention, we have done some initiatives. The Health Choices programs did some initiatives for staff retention as well, and that's something we definitely know that staffing is an issue across the board, not only, again, within our office, but with all the providers. So I don't know, Dr. Taylor, if you have any additional comments you want to make on that.
No additional comments. I think you've kind of covered it all.
Thank you. No more questions? Okay, well, again, I want to thank everybody for coming, and I don't know if you'd like to make closing comments?
Sure. No, that's okay. Well, I'd just like everyone to thank everyone for joining us, and of course, again, to thank our team at Human Services for all that you have done. As you have clearly laid out, we have implemented so many programs and so many services for our community members, and during this past year, or even really the past 2 years, you have really showed your effort and your dedication to this county in the way you have been able to pivot and change and adjust so quickly and so frequently due to COVID or due to what's going on with prospect closure. Thank you for what you are doing and what you have been doing for our community. And with that, thank you all for joining us.